We've got a bit of a roller coaster weather, as you've been tracking there for us. A glimpse of those triple digits, the rain for Mother's Day. But regardless, your skin needs to be top of mind. Dr. Dustin Mullins from Affiliated Dermatology is here this morning. We also want to talk about the new FDA guidelines with sunscreen that just came out this last week. Walk us through some of that and some of the things that you have here for us.
Absolutely. So recently, the FDA came out with some new standards for testing with sunscreen products, treating them as basically a medication, and it's going to require them to go through more extensive testing because of the concern for systemic absorption. So currently, right now, as it stands with the FDA, there's only 2 mineral-based sunscreens that they accept as generally safe and to use daily. That's going to be your zinc and titanium dioxide. So those are your mineral-based sunscreens, not your chemical-based. The chemical-based ones are typically what we associate with your sport, sweat-resistant. Those ones are going to need further testing to elucidate whether or not long-term use is associated with any increased risks.
And so for May as well as Melanoma Awareness Month, but it really needs to be top of mind all the time. How often should people be putting on sunscreen and reapplying sunscreen?
Good question. So everyone should be reapplying sunscreen every 2 to 3 hours. Generally, we recommend you use about a shot glass that's 1 ounce, and you apply it to everywhere that's exposed, including your arms, hands, face, neck, ears, anything not covered by clothing. And then you should also use safe sun safety practices. So that's sun protective clothing, that's long sleeves, that's going to be a wide-brimmed hat, UV protective sunglasses. You're going to want to avoid the peak hours between the hours of 10 and 4 typically. Sometimes we'll tell our patients if you can't see your shadow, run. That means that means the sun's at your peak hours, and that's going to be its most intense. Other things that we recommend is that just being very conscientious about their exposure, trying to limit that as much as possible.
And SPF, what should we be looking for on the number that's on the bottle as well?
So the FDA came out with their recommendation that it should be no more on the labeled bottle SPF of 60. That's the highest that they allow you to advertise now. That's the new recommendation. The minimum you need is an SPF of 30, but the key is it says broad spectrum. Broad spectrum means it's going to block both types of ultraviolet light because there's 2 forms depending on the wavelength, and they can cause skin cancer, that's your UVB, and sun aging or damage to your skin that causes dyspigmentation, brown spots, and advanced acceleration of wrinkles, all those things that we don't want, that's your UVA. So if it doesn't say broad spectrum, it's not going to protect you from both of those, and you need a protection from both.
Perfect. And if people want to come to your dermatology, where can they go for more information?
So Affiliated Dermatology, we're the largest based private derm practice in the state of Arizona. We have comprehensive care running from aesthetics to general dermatology to skin cancer treatment, including Mohs procedures. They can find us at www.afterm.com.
Thank you so much, Dr. Dustin Mullins with Affiliated Dermatology joining us this morning. A lot of great information, and we'll be back after this short break.